This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us today. And you know, holidays are coming, and we need to think in terms of having safe holidays. And we're delighted we've got Mary Harrell with us today. She's the Trauma Injury Prevention Coordinator at Medical City Dallas and Medical City Children's Hospital. Mary, welcome to the show.
Thank you for having me. I appreciate it.
You know, I guess we can kind of look at some of the holidays and the order they're coming. What are some things that you look at that we should keep in mind so that we protect our children while they're out and about?
Usually when it comes to the children and the kiddos and holidays, usually our focus is Halloween time. It's late at night, it's dark, there's going to be a lot of kids and adults running around as well as vehicles. So the main thing we like to really focus on is making sure that kids are aware of their surroundings. This seems obvious, but hopefully they're out with an adult late at night when they're trick-or-treating and such. Kids get very focused on the candy. They get real excited to be out past their bedtime. So they tend to not focus on some of the dangerous aspects around them. For example, vehicles traveling through neighborhoods or stopping at the stoplights and looking both ways. So just making sure that they are aware of that as well as having fun. Another good thing to do with kids, of course, is to make them visible. I know Halloween, typically kids want to wear all black or really dark colors and, be hidden, but that's really just not the safe way to go about things. If possible, having them wear like glow stick bracelets, glow stick necklaces, or even like reflective material, maybe on their like trick-or-treat bag would be really good. That way, especially vehicles can see them coming and kids aren't just, running out and, getting hit by accident. They're just making sure they're really focused on everything going on around them.
You make a good point about traffic safety. What is your advice to parents? We know kids want to be really cute on Halloween. They put on costumes, they put on masks. What about the visibility of seeing through some of those costumes? What is your advice to parents on safety and vision?
Yeah, so like I said, really trying to make their kids visible is going to be the best thing. Dressing them in brighter colors if possible. Neighborhoods tend to be pretty good about having street lamps, throughout the streets. So usually kids are going to be lit up, but especially for parents or chauffeurs who are driving through the neighborhoods during Halloween night, there's going to be probably a bunch of rambunctious kids in the back of your vehicle, real excited, hyped up on candy, which is great and fun. But, those drivers need to really pay attention as well. Stay off your cell phone. Don't try and be taking pictures of your kids in the back. Pay attention to the children, walking, running in front of you, that sort of thing, because that could easily, be your own child.
Do hospitals look at their emergency departments and over the holidays tend to have more frequency as far as use?
Absolutely. So the holidays is a really big time for accidents to be occurring. So this could be anything from, falling off a ladder while trying to hang up Christmas lights, or someone's in the kitchen carving the turkey at Thanksgiving and they, cut their hand, cut their finger real deep. So holidays, as we all know, is a great time to be with your family and friends, catching up, all of that. But in reality, your own safety needs to come first. So just like when you're carving the turkey, you may be, talking with your son, your grandson, your friends, and that's fine and dandy, but make sure you're paying attention to where you're putting that knife, because if you're not, it's a really good way to cut your hand open, and no one wants that and ruin the turkey, right? So not just that, but if you're going to be hanging Christmas lights or hanging any sort of decoration at all, and you're using a ladder, you really, really want someone else to be with you outside, or even if you're hanging stuff up inside your home. A ladder is something that can be really dangerous if you're not using it correctly. So having someone there in case you were to fall, or if that ladder slips out from underneath you, they can grab that ladder, secure it, or, worst case scenario, they're able to call 911 and get you help. Another thing we see a lot of is vehicle accidents. Holidays, there's just a ton more people on the road traveling, people's houses, and people shopping. So this is definitely the best time of year to put your cell phone away, turn down the stereo, and just focus on the road. Stop, making lists in your head and yelling at the kids in the back. Just really, really pay attention to what you're doing. Make sure you get to your destination safely.
You brought up a couple of points I want to do a little follow-up on. In addition to hanging lights and having ladder safety, what about where people overload the circuits with their lights, or they put them outside where if it rains or there's moisture, they short out? Do you see many people with fire, where they get burnt because of Christmas decorations?
Yeah, so aside from them potentially hurting themselves, that presents a fire risk to the home as well. So a lot of people, they will use indoor lighting for outdoor use, which sounds obvious, but that is a big no-no, as well as extension cords that aren't meant to be outside in the elements such as rain or ice or snow. So you want to make sure if you are using lighting that, your electrical sockets are in working condition, they're not cracked, it's not sparking out at you, because that could very easily cause a fire. And you want to make sure that you're not overloading those sockets. And you want to make sure as well, if you're going through like string of lights, for example, that none of them are broken, there's no shortage anywhere. The last thing you want to do is wake up in the middle of the night, because your house caught on fire. That would be an absolutely horrible thing during the holiday season. So make sure you're following those directions. I know sometimes it seems annoying, but it really is there for your safety.
And I assume also, just listening to what you're saying, if you have a live Christmas tree, keep it completely watered, because that could become a fire hazard also. Would you agree?
Oh, absolutely. If you have a real Christmas tree, you're supposed to take care of it, water it just like any other plant. A lot of people forget to water it, or they just don't water that tree enough. And so it becomes very dry, very brittle. And people love to light candles around the holidays or have the fireplace going, which is great. But if you have a very dry Christmas tree near a source of fire or flame, that can very easily go up in flames. And then from there, just wreak havoc throughout the home. So definitely make sure that you keep it watered. Or if you were to get a artificial tree, they have labels and trees made specifically that say fire resistant. And make sure you get those.
Mary Harrell here from Medical City Dallas and Medical City Children's Hospital. Great tips on staying safe during the holidays. This interview is on our podcast and YouTube channel as well, The Human Side of Healthcare.
This is The Human Side of Healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome back. We're continuing our conversation with Mary Harrell from Medical City. She's the Trauma Injury Prevention Coordinator, and what a great title to have a perspective on so many things that cause injury among us, especially during the holidays. And Steve, there's one little area that seems to creep up anytime there's a holiday get-together conversation.
Would you say over the holidays sometimes a little excessive celebration impairs the drivers, and we need to be careful about that?
Absolutely. Like you mentioned, the holidays, people are getting together. They're usually in really good spirits, and they can consume a little bit more than what they would usually consume. So making sure that if you are, walking in between restaurants, or you're shopping after you had a little bit of alcohol to drink, that you're still paying attention to your surroundings. So again, not being distracted, not being on your cell phone, not play fighting with the people around you for the younger adults, as well as making sure you don't drive. I know a lot of people, like I said, especially young adults, they believe they're invincible, and that's just not the case most of the time. So making sure that you use Uber, Lyft, you have friends and family that can come pick you up. You just want to make sure that you're not only putting yourself in a good position, but you're keeping everyone else around you safe as well.
As we move into the winter, holidays or not, sometimes we get snow, we get ice. Do you have any thoughts for our listeners about being safe on ice?
Yes. So actually, falls are the most frequent injury of all age groups. So that goes from toddlers all the way up to the elderly. So first things first, when it comes to ice, if you don't have to leave your house, don't leave. Sounds real simple, I know. But if you absolutely have to go out for something, you want to make sure you're wearing flat shoes. So no heels, no platforms, nothing like that. And then make sure that they have a rubber sole on them. It provides a lot more traction than leather or plastic soled shoes. And if you are walking, you want to actually keep your center of gravity directly over your feet. So to do that, you're going to lean forward ever so slightly to keep that center of gravity. So you don't want to be leaning backwards or to your side. You may feel like leaning sideways may help you balance a little bit better, but it actually does not. And then if you are walking, trying to hold on to solid structures. So if you're walking up a staircase, for example, go ahead and use those handrails. That's what they're for. Or if you're walking down your driveway, hold on to your vehicle, something like that. And another really big point that I don't think a lot of people think of, myself included, is don't keep your hands in your pockets. So obviously it's going to be cold outside, it's icing, it's snowing, what have you, but you want to have your hands free. That way, if you were to fall, you can grab onto something if possible, like a handrail if there's one nearby, or maybe there's a strong tree branch, something like that. Worst comes to worst, you don't really want to put your hands out when you fall, but if it's between falling with your hands out or falling on your face or your head, you obviously would rather fall onto your hands and protect your face. So definitely keep those hands free and keep them out of your pockets.
This is Thomas, Mary. What is the number one issue that you see?
It would probably be falls. Usually the elderly fall a lot at Christmas, well, any holiday really, just because they are not keeping a safe space, like within their home. So for example, there's lots of electrical cords that are out, or they have, extra presents out, extra decor, things that aren't usually in their home year round is now in the area they're walking. So that causes a trip hazard. And that kind of applies actually to young children as well. They're not used to having these cords and presents, decor, what have you, in their space. So when they're learning to walk or learning to run, they just take off and end up hurting themselves, unfortunately.
You talked about keeping our minds on safety first, slowing down. And yet we are human, and we get distracted, and we get more focused on what is in front of us, as you said. When you've seen people actually shift from not being so safety first conscious to really being safety first kind of people, what do you see them doing to make that shift?
Yeah, so making that shift, a little bit of everything I just said. And I think, so for example, when people learn to put that cell phone away and pay attention to driving or just walking, whatever it may be, not only are they becoming more safe for themselves, they're becoming more safe for other people around them as well. It's kind of a domino effect. If one person in your group, puts their cell phone down and pays attention to their surroundings and the people they're with, another person is going to do the same thing, and then another person. And then soon, not only, is your whole group being safe, but you're also enjoying each other's company the way the holidays are intended to be. So you're just making a great situation just from doing something as simple as, putting the phone away.
Steve, question for you. You've been in healthcare all of your career. I perceive you as a person who prioritizes good health, and part of that is being careful and being safe.
Oh, yes, definitely. And I think the advice Mary gave us about take your time really is so important, because I can tell you every time I've gotten in a hurry and I had a problem, it was because I was in a hurry. And she gave some great examples. And I think a lot of times people end up in the emergency department because they got a little careless and got in a hurry.
But over the years, has it morphed for you that you would say primarily you stay consciously focused on staying safe?
Oh, absolutely. No question about it, especially when I'm driving. I try to do defensive driving. I'll give you a great example. The other day, the light was solidly red because it was green where I was coming through the intersection, and had been green for a good 5 seconds, and yet a car came flying through. I caught him out of the corner of my eye and stopped. So to answer your question, yes.
Yeah, good. I figured. Thank you. Mary, another area that you and Steve talked about was alcohol, and obviously that's going to happen. But when you think about 0.8, I think, isn't that what the Texas thing is? I stopped drinking years ago, so I don't know. But it is such a little tiny amount of alcohol that if you get pulled over, you're going to get in trouble, and it's going to be expensive.
Correct. Yeah, so 0.08 may not seem like it's much, and it's not. It obviously depends on your drinking habits, your size, male versus female, etc. But, the point of the holidays isn't to drink to the point of being inebriated, because then people tend to make poor choices and they don't remember what's going on around them. And that's not really the point of the holidays. You're supposed to be spending time with family and friends, enjoying this special time together. So there's really no use in drinking that much. But like I said, if you are going to go that far, make sure you have a game plan ahead of time if possible. Schedule yourself a designated driver. If you can't do that, get an Uber, get a taxi, get a Lyft, have someone else drive you. There's absolutely no good reason, not one, to get in a vehicle at any point in time and drive intoxicated. There is no good reason.
I totally agree with you on that. And we could also extend that impairment to things like even medications, illegal drugs, sleep, fatigue, stress. There's a whole big long string of things that could affect that.
Absolutely. And you mentioned sleep, which is actually a great point, because, there's been studies in the past where if you run on being awake for 24 hours, so no sleep within a 24-hour period, it's the equivalent to being intoxicated. So you're absolutely right. Medications, other drugs, substances, none of it is a good idea.
Well, and this goes back into that basket that we were just talking about is, are you going to be a safety first mentality kind of person, or are you going to run the rails?
Exactly.
What about holiday loneliness?
Yeah, that can be tough for a lot of people, and that's typically where we see some of the substance abuse and alcohol or medication abuse. It is hard being lonely on the holidays. However, try and surround yourself, if possible, with friends. A lot of people don't have family where they live, and that's perfectly fine. Have plans ahead of time for your coworkers, if possible, neighbors. I know a lot of neighborhoods, and mine especially growing up, they always had a block party for those who didn't have family nearby. They would have like a Friendsgiving or a friend Christmas gathering. There's always options out there to be involved. You could even go to a soup kitchen and hand out meals on the holidays. There's always something you can do.
This has been Mary Harrell. She's the Trauma Injury Prevention Coordinator at Medical City, Dallas. Great tips to keep in mind. Next, Dr. John Christoforetti from Texas Health Frisco talking about one of the biggest areas of injury, sports injury, on our body. And you're going to be surprised. Stay with us.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the human side of healthcare. We're delighted you're with us today, and we want to talk a little bit about sports medicine and some of the injuries that athletes have to deal with. We're delighted that we've got Dr. John Christoforetti with us from Orthopedic and Sports Medicine with Texas Health Physicians Group, and he's a specialist at the Texas Health Hospital in Frisco. Welcome to the show.
Well, thanks for having me here. It's great to be here.
You know, I think one of the injuries that athletes sustain sometimes relate to the hip. How do athletes generally have hip injuries?
That's a great question. You know, there really are two types of athletic hip injury we could understand most easily. One would be an all-at-once injury where they may be out playing on the field and feel a pop and hurt something. And then the other would be one that comes on gradually while they've been training and getting ready for the events, and they have a gradual creep up of hip pain.
You know, you mentioned the types of injuries, but generally, what activities are athletes doing that might lead to one of those hip injuries?
Well, we know that collisions on the field where one player strikes into another player or when the player strikes into the ground can lead to injuries like fractures or even tears of the soft tissues, bruises, or the old hip pointer. But we also have some new evidence and information about the ways in which people lift weights, run, sprint, swing a baseball bat, or kick a soccer ball over and over again that might cause wear-out type injuries as well.
You know, that's a great point in your answer. Even the way you swing a baseball bat. So you could have wear-out injuries just playing baseball that impact the hip. Is that correct?
It's really something. And in fact, back in 2006, I was helping out with the Colorado Rockies, and we had a suspicion that some of their shoulder elbow injuries might relate to their hip. Sure enough, when we took a look, we found a number of those pitchers in our organization had impingement or bone shape changes in the hip, and that was affecting the way that they were throwing. That was a long time ago, but we've been able to look around the country and around the world at finding more things out like that every year about the way the hip affects common athletic activities like baseball.
Would it happen in golf also?
One of truly the most interesting stories of an athlete's hip was with Greg Norman, and with the PGA coming up here to Frisco, that hits home. Greg was one of the earliest athletes to publicize his struggles with hip pain. Now, he's had his hips replaced down the road, but back in the early 2000s and late 90s, he was one of the first that showed us how we can help athletes that are breaking down in their hip.
You know, you mentioned in the early part of your answer, obviously, contact sports. You know, in some like football, you wear pads, but soccer and some of the other activities that athletes do, those can produce hip injuries also, correct?
That's correct. Here, our FC Dallas players are constantly under the strain of pounding of running on a very, very hard surface, which soccer players call the pitch. And sometimes just through cutting and pivoting and striking that ball so hard, they can tear the muscles or tendons around their hip. And that's probably the most common area. But then even if they collide, fall, or slide tackle into the ball, they can land straight onto the ground and create other types of injuries at the hip.
You know, you mentioned running. So to our listeners out there that love to jog and have activities, they, if they're running on a hard surface, I assume, could also sustain a hip injury?
Yes, I think running is generally very safe, and it's really great for people to get out there and get in the fresh air. Sometimes what we get into with runners are just what are called overuse injuries at the hip, where they may just run and not give themselves enough time to recover and rest after those outings. And those can lead to some irritations into the bones or into the tendons and joints.
You know, when you think in terms of sports injuries, and especially a hip injury, does family history or your age in any way factor into those injuries?
Well, especially as I get older in years, I like to say age doesn't matter as much, but undoubtedly there are some things that are more common in children and then some things that may be more common in older adults. But I would suggest that when one is an athlete or is doing athletic participation, the sports really make us more similar than our age makes us different. And it really depends on what sport they're playing. I can tell you that there are certain development conditions that are either present at birth or develop as we grow that do leave the hips in different forms and different shapes. And some of those shapes are not awesome or great fits for exactly the repetitive sport training that the person chooses. Sometimes you don't know that until you've been at it for a while. And lo and behold, you understand you're having hip pain while others didn't. And it may turn out that you had a development condition that made your hip a little bit less suited for the way you're training.
Can you talk about treatment generally that you have to render when you have a hip injury?
Sure. One of the most important things to remember about these two categories, meaning a trauma or a really acute injury, I've fallen, I can't get up, I've really hurt myself. Treatments in those cases when someone just can't walk really are emergency treatments. And let's talk a little bit less about those. If we talk about the more common injuries to the hip, which are going to be those overuse related or gradual pain in the butt, if you will, pain in the groin, pain in the outer hip while we're training, one of the mainstays of treatment is physical therapy. And what physical therapists can do is help recondition the muscles, both the core of the abdominal spinal area as well as the hip muscles. And they can also provide stretching and other type of instruction about how to get ready and calm down from your injury before you get back into your sport. So I would suggest that physical therapy is probably one of the most important for hip medicine. And secondly, we can think about things like applying medicines that the doctor might write, like injections of various forms to the sore parts. But ultimately, my job is to do surgery on tissues when both therapy and injections or medicines and rest have just not worked and you're just unable to get back. And we have many operations that we can do now that are minimally invasive and repair those tissues to give that body the chance to heal and then back to sport.
You know, for our listeners out there, obviously, if they have severe pain and they're having significant problems, they need to come to someone like you, a medical professional, for treatment. But if you're having some minor pain, do you have any helpful hints on maybe home remedies you can do to alleviate some of that pain and, discomfort?
Well, one of the most amazing medical devices that was invented by human beings is the cane. And it's something, whether a walking stick or a cane, is something that can really be available pretty readily. And if someone's hip's having trouble, if they just put that cane, and here's the tip, if they put it in the opposite side of the hip that's hurting, that's usually a lot more relieving than if you put it on the same side. And that's a little bit counterintuitive.
That's great advice. The other thing I wanted to follow up and ask you on, if someone is going to have hip surgery, are there different levels of hip surgery, or can you explain the treatment you'd undergo?
Yes, I think that that's a great question, because sometimes when people imagine hip surgery, they're going to imagine something very, very invasive with larger incisions, or even the most famous hip surgery, which is to get your hip replaced with an artificial joint. But nowadays, there's really a scale of surgical treatment that starts with things like injections, which are types of procedures with needles, and then it might move through what I do, which is to do smaller incisions, minimal invasive incisions, where a camera is placed into the tissues around the hip joint or into the joint itself, and that is called arthroscopic hip surgery. And then in those operations, we can both repair tissues, rebuild them, and even reshape the bones themselves. The next level of surgery is to do a surgery where we operate on the hip, but we don't replace it through an open incision. And that's called open hip preserving surgery. And then ultimately, the surgery that everyone's pretty familiar with these days, the replacement of the hip.
To our listeners out there who may be undergoing soon hip replacement, do you have any advice for them on kind of things they should consider?
When we're talking about hip replacement surgery, the first thing is to make certain that you are in the right place with your life and with your goals, that your hip pain is so severe that you really just 5 out of 7 days a week really just can't live your life the way you want to, because that's how bad the pain is. Anything short of that, we're probably not ready for replacement. That's tip number one. I would say tip number two is you really need to make sure that it's a fit with your surgical team. And in Dallas-Fort Worth, there are many, many outlets where you can interview a couple of surgeons and make certain that it's the right replacement. I must admit, I don't do replacement surgery in my role, but I partner with numerous replacement surgeons around the Metroplex, and they focus only on replacement. And once you get into that really best fit office for you, really it's about understanding what exactly is going to happen and when am I going to be able to walk again, and when am I going to be able to do the things I want to do again. Write those things down so that you know the timeline of your recovery.
I know there's been a lot of innovation over the years in treating hip injuries and even hip surgeries and hip replacements. And I know you do research. How has that impacted the way you treat hip injuries?
What's the most helpful thing about the question you asked is it just shows how far we've come in understanding that research isn't just trying to take a test tube in the lab and find the next cure for something. Research is also about tracking how do our treatments work on the patients that need them. So the way that we use that research in our practice is by asking our patients to participate with a secure software that lets them report exactly how they feel before the surgery. And then we ask them again at a year, 2 years, 5 years. All of those answers are pulled together, and it helps us really learn exactly what the right moves to make inside their arthroscopic surgery to help them get the surgery itself improve year after year, so that the patients that we were working on back in 2007 got our best available treatment in 2007, but today's operation in 2022 benefits from all of those procedures that went before it.
This is a great conversation with Dr. John Christoforetti. He is an orthopedic and sports medicine specialist at Texas Health Hospital Frisco and also is part of the Texas Health Physicians Group. This interview and all of our interviews, including Janet St. James, if you missed her last week, and Eric Nadel coming up next week, are on our podcast, The Human Side of Healthcare, also our YouTube channel under the same name. More on sports, injuries, and hips next.
Covering the healthcare topics that matter most to North Texas. This is The Human Side of Healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're talking to an orthopedic surgeon about our hips. This is Dr. John Christoforetti. He is with Texas Health Hospital Frisco and the Texas Health Physicians Group. Now, this is not a sports-related question, but for those of us on the upper timeline of life, scoliosis or curvature of the spine can come in and start putting pressure on our hips. Is that right?
This is a really, honestly, a very deep question, Thomas. I'm not surprised given your wisdom. My feeling is this is a chicken or egg phenomenon. We call this the hip-spine conundrum or the hip-spine syndrome. What makes what? Does the curved spine put force on the hips, or does the misshapen hip put more force and break down the spine? And this is something that we probably won't figure out in this call, but what I can tell you is that just like we all learned that the shin bone's connected to the thigh bone and the thigh bone's connected to the pelvis bone, we know that the hip and the spine do affect each other. Scoliosis in and of itself in the younger age groups is something that's screened for in schools. As you get older, adding a new curvature to the spine is often a little bit separate from what's going on in the hip.
The other thing that you and Steve mentioned that really surprised me is you used the term wear out referring to athletes. Now, I would think wear out is in your 60s, your 70s, maybe carrying a few pounds in your 50s, but wear out really in what, teens and 20s?
What's really unbelievable, and I know that this can stretch the imagination, but that's what the value of these high-definition camera surgeries has given us over the last 15 years. You know, we would tell the old athletes back in the 80s, 70s, 60s, that's a groin pull. But as we've gotten the technology to look inside these joints, what we see is not all that counterintuitive as you would think. You could just imagine if you took a race car and you put it in the showroom, its tires would last an awful lot longer than if you took it out and you raced it every single day down at the Texas Motor Speedway. And the reality is that our athletes have such repetitive force and load and revolutions on the cushion surfaces of their joint that indeed they do have some areas that really do look like wear out, for lack of a better term. And I think the common English would be that you've worn that cartilage out in the spot where the most force of exercise is going across.
So does that mean that we've missed this all those years before?
It's a great question, and it's one that a lot of the world healthcare systems are really looking into, because the global cost of breakdown of joints in the knees and the hips, meaning in the countries where every citizen can get a replacement because of their taxation, that costs them a tremendous amount of money. So there's a lot of evidence and research mounting to try to figure out how do we preserve, prevent, and delay the breakdown of joints. And the number one message is that you should be active. It's a good thing to be active, but there are some hip structures that make that activity loaded funny and maybe make the wear pattern not quite right. Not unlike a bent axle wearing your tire unevenly. And that's where joint preserving surgeries and other bony changes to the hips, when we have our young athletes go through surgery, we're really protecting the alignment of that limb to protect the bearing surface better.
So let's say a kid shows promise, does well, gets into college on a scholarship, gets drafted into the pro. That person in the 70s, what would have happened to their body versus somebody on that track in 2022, 23?
Well, you know what? I got to tell you that the whole world has changed. It's a wonderful book that's called Players, How Sports Became a Business. And I think that's an excellent book to read. But as we've infused a lot more money into the sports economy, and we look into those professional athlete groups, it's really has become a different planet, not just medically, but also economically, and the motivation of what professional sports looked like in the 70s. But what I would say in summary about how those things are different is nowadays you're going to see our athletes are faster, stronger, higher muscle mass, higher forces across the joints. And we do see in all of our professional associations, Major League Baseball, Major League Soccer, NFL, you're seeing that as players finish their competitive careers, there are much higher rates of breakdown of joints that were there back in the 70s. And you know what? They're still there now. And a lot of that's just because the sport itself does take its toll. But what you always want to tell people is that's why we use our fourth rule is you got to be having fun. And I've not met people that have regrets if when they went out and played, they were leaving it all on the field and they loved what they were doing. It's only when they get into regrets that they felt they were playing and it wasn't what they really wanted to do.
Wow. So as the technology has increased, so has the pressure on the body. So you're kind of at the same place, just on a higher level.
Isn't that something? And I think that's probably the same you could say about those classic cars in the 70s.
Yeah, exactly. Exactly. All right. I think a minute ago you spilled the secret sauce. You mentioned a high-definition camera. Tell us more.
Well, when we started arthroscopic surgery, we just did some case this morning where I was mentioning to our learning observers, the original way to look in the joint was with a rigid stick that looked like a straw and had just a lens through it, like you were peering into the joint. And now we've got extraordinary technology with fiber optic lens cables that allow us the opportunity to bend the light and make these images of the interior of the hip surfaces so crystal clear that it gives us an even greater opportunity to look and identify early injury and repair it. So this has been really a progression of technology from the original tube-like look in there, see what you can see while you squint, all the way now to the modern operating room where we're having patients that are having 2 and 3 tiny 1 centimeter incisions with the ability to have ultra high definition 4K images of the interior of their bodies. And that gives doctors and their teams an incredible opportunity to observe better. And when we can observe better, we can diagnose better and therefore treat better.
Yeah, that I was going to say doesn't hurt the aging doctor one bit either, does it?
Yeah, it is true what you are saying, although I would like to not admit that I know that.
Well, and you just hit another point. Minimally invasive, so you're not having to make as big of incisions, not having to go through as much muscle, all of the above?
Yeah, the key is to this is kind of a philosophical point, but when we train the residents and fellows, the doctors that are learning under us, I'll say, we want to use the living room end table rule. Like if you whack your shin off the end table in your living room, man, that hurts and you could feel it even the next day. So we want to respect every tissue that we don't have to invade while we're operating to reduce the pain and the recovery and treat our patients when they're asleep just like we would if they were awake. And that includes not only the length of the incision, but where the incisions go and how they go through, but also how you handle the whole leg while you're working with it. So it's just a philosophy of minimal invasion that's about the incision, the technology, but also how we handle our patients' well-being while they're there.
So what's the recovery time for a hip versus, say, a knee?
A lot is in the details, as it were, but our arthroscopic surgeries for the hip do tend to have kind of a shorter and a longer recovery in some way. I'll say it this way. Our arthroscopic repair procedures about the hip itself generally only keep our patients on crutches for a couple of weeks. But then it's about recovery over several months to get back to sport. And we've published that 96% of our patients after hip surgery are running at least a mile 3 days a week by 4 months after surgery. When you look at anterior cruciate ligament surgery or the ACL surgery of the knee, which we do regularly as well, the U.S. standard is between 9 and 12 months to return to sports. So we're actually getting our hip surgeries back a little faster than the knee surgeries.
You know, that's great information. I've asked you a lot of questions, but to our listeners out there, do you have any nuggets of knowledge that you want to make sure you share with them that I may not have touched on?
One of the things that I think is helpful for people that are just getting interested in learning about athletic hip injury is you can maybe take 4 rules that we use with our athletes and say, you know what, if you're not having these 4 things, then you're probably okay. And one of them is limping. We don't like people to be out there limping around because their hip hurts. If it limps, you got to get it checked out. Number 2, we don't feel our athletes should be able to play sports and then require taking meds like Advil or Aleve. We think they should be playing without medication. If you have to have medication, you probably got to get it checked out. We also think fun is super important in your athletic endeavors. And if you're having no fun because your hip's hurting you, you probably got to get it checked out. Then our 4th rule is if you have had your workout, you should be able to have that workout, get up the next day, and feel ready to go. If you feel like you're paying for it in your hip, probably a reason to go get it checked out. So those are our 4 rules that we have for participating with sports if your hip's a little sore.
And what a great place to leave it with that advice from Dr. John Christoforetti from Texas Health Hospital, Frisco. Steve?
You know, Thomas, Dr. Christoforetti was just talking about fall sports. Lots of crowds, people gather. Maybe it's a good time to talk to your doctor or your pharmacist about getting that flu shot. Join us next week for the human side of healthcare.